At the Peel Weight Loss Clinic, we evaluate each patient individually. We will book you for an in-person or virtual consultation with myself, where we'll evaluate specific things including your age, your weight, your pre-existing health conditions. You'll also meet with our dietitian preoperatively to determine if you're a good candidate for the sleeve gastrectomy. The sleeve gastrectomy is a minimally invasive surgery which we do with a camera and small incisions. The surgery typically takes an hour to an hour and 15 minutes. We use a special stapling device to divide and seal the stomach. All of our patients are fully asleep with a general anesthetic. Your anesthetic will be supervised by a Royal College certified anesthesiologist. We do the sleeve gastrectomy in a minimally invasive way with a camera and small incisions. Our patients typically have 5 small incisions. How much time you take off work depends on what type of job you do. Some of our patients who do mainly office work or work from home with a computer can often return to work after a week. Some of our patients who have more labor-intensive jobs often have to take 2 to 4 weeks off. We will provide supportive documentation for you to allow you to have the appropriate amount of time off to help you heal from your sleeve gastrectomy. During your consultation to determine if you're a good candidate for the sleeve gastrectomy, we will make an assessment whether or not you'd benefit from a special preoperative diet. Some of our patients we put on OptiFast, which is a medical grade meal replacement program. The reason why we put you on that prior to the surgeries is that it causes your liver to decrease in size, which helps do the sleeve gastrectomy surgery. There are third-party companies that provide financing for many of our patients, and our clinic staff would be happy to help you assess the different options available to you. Typically, we can book patients for the surgery within 3 to 4 weeks after their initial consultation if we determine that they're a good candidate for the sleeve gastrectomy. Certain things have to be done prior to the surgery. In some cases, patients have to take a specialized diet, which is often 2 weeks long prior to the surgery. We also arrange for routine blood work and a consultation with our dietitian and our anesthesiologist. Typically, we can get all of this organized within 2 to 4 weeks. The gastric sleeve is covered by OHIP in 2 situations. One, if your body mass index is over 60, or if you have underlying health conditions such as Crohn's disease or inflammatory bowel disease that preclude a gastric bypass surgery, or if previous abdominal surgery precludes doing a gastric bypass surgery. We put our patients on a graduated diet after the surgery. The reason for that is there is swelling in the stomach as it heals. That swelling often subsides over 3 to 4 weeks. There are multiple phases of the post-operative diet. In phase 1, you'll just be on liquids. Then we advance you to full fluids, which is thick liquids, then soft solids, pureed, and then we get you back in regular food, which is typically 3 to 4 weeks after the surgery. We've helped many patients who have had laparoscopic adjustable gastric band, converting them to a sleeve gastrectomy. Many patients, unfortunately, have not achieved the successful weight loss they had hoped with the gastric band. In many cases, we're able to remove the band at the same time and then convert your surgery to a sleeve gastrectomy with excellent results. We typically do the sleeve gastrectomy for patients between the age of 18 and 65. We will individually evaluate you and see if the sleeve gastrectomy is a good option for you. Both men and women benefit equally from the sleeve gastrectomy.